Good morning, everybody. Dr. Z here, sending you an early 4th of July greeting for all of our viewers here in the United States. Independence Day is just a couple days away, and so I hope everyone enjoys the festivities safely and responsibly while still having fun. Today's topic for Oral Pathology Corner, continuing the trend of the last few weeks, is talking about something related to wisdom teeth, which is dry sockets. And I guess first it's worth mentioning that dry sockets can happen with any tooth being extracted, but is especially common with the wisdom teeth. I'll explain why here in a second, but um, essentially what a dry socket is when a tooth is removed, we've got that open socket where the roots of the tooth used to be, and we want that to be filled in. We want that to be insulated, so to speak. That's kind of how I like to explain it. Um, so when a tooth comes out, we want that socket to start filling in with blood, get a good blood clot forming there that will act as that insulation and kind of hold things over until that bone starts to heal and fill in. And in the event that that blood clot does not form or the blood clot comes out, then we've just got an open exposed socket. We've got exposed bone with nothing there to insulate it from hot and cold and all the elements. And that's what a dry socket is that exposed socket that's dry because it doesn't have the blood clot in it. And a number of reasons dry sockets can develop. Um, really, they're going to form most commonly due to some kind of activity after the tooth or teeth come out that causes that blood clot to dislodge. And so those activities would include anything like, spitting really hard or sucking really hard through a straw. That suction force can take the clot right out of the socket. Um, Anything that gets blood rushing to your head can kind of pop that blood clot loose. So that would be anything like running, jumping, exercising, heavy lifting, um, even just bending over to pick something up. Anything like that is going to cause blood to rush to your head and, again, can potentially dislodge a blood clot and create a dry socket. And then also, for those who smoke, there's a reason that you're told not to smoke after having a tooth out, and that's because the chemicals in various cigarettes and whatnot constrict the blood vessels that are going to cause that blood clot to fill in, and so you don't get that proper healing, you don't get that proper blood clot, and that probably more than anything is the most common cause for a dry socket. And that's why anytime you have a tooth out, your dentist or oral surgeon is going to tell you no smoking, no straws, no you know vigorous activity for at least a few days afterwards. The longer you hold off, the better, but at least the first 48 to 72 hours are the most important. And that's not to say it's black and white like that. Someone can follow all those directions to the T and still develop a dry socket just because they healed up weird and just bad luck. And on the flip side, somebody can ignore all those rules, do everything wrong, and still be lucky enough to not have a dry socket develop. And again, part of that's just luck, and part of it too is human anatomy that anyone that's had a dry socket will tell you it's usually with a bottom back tooth. And again, without going into a long anatomy lecture, that's basically just because of the way our mouths are, that lower back area of your jaws is going to be the most common place to get a dry socket. Again, not exclusive, but most common. So, and as far as what a dry socket looks like, it's going to look something like this. And as far as symptoms, anyone that's had a dry socket will tell you. I've had female patients tell me that a dry socket is more painful than childbirth, to give you an idea. So dry socket, very, 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 very painful. Worst toothache you can imagine from what I've been told. And also characteristic of dry socket is you're going to have a very, very bad taste in your mouth. Those are the two hallmark signs of a dry socket. And as far as treatment for a dry socket, more often than not, unless it's some unusual circumstance, treating a dry socket is basically going to consist of taking whatever pain meds your dentist or surgeon prescribes, and then usually going to place a dressing in that socket, some kind of dry socket gel that is going to soothe the area, kind of numb the area, and also fill in that socket so that it's no longer dry. And yeah, that in a nutshell is what dry sockets are. So, hope you found this information useful. I hope if you're viewing this video that you've never had to experience one. But if you have, you've lived to tell the tale and can testify that it is not fun at all. So, but again, hope everybody has a wonderful Independence Day, and I hope you will tune in to next week's episode of Tooth Teacher Tuesday.